I think our viewers are sitting here saying, I'm not getting this. Here's a doctor as an activist against the medical profession. You can see, you know, if it was a lawyer, if you were a lawyer, or you had a personal, not vendetta, but an experience. But why as a doctor? What is it that drives you?
Well,
you're trying to clean up your own profession.
it's even much bigger than that, because my profession actually is a victim. There are a huge number of tremendously skilled, dedicated, and wonderful physicians.
Obviously.
I, for 14 years, was duped. I didn't know myself in what environment I was living. It's not just the audience that is not aware. I would not be surprised that still
other
today,
doctors, the medical profession, is not attuned to this issue.
No. It's so well...
Maybe they don't want to hear about it, because it is, could be self-destructive. At least that's what they would think, financially.
You see, for the good doctors, it cannot be. It's only for the bad doctors. And I don't believe there's more than 5% of such physicians.
That are in the bad category.
Yes. But the 95% of physicians suffer the consequences of the conduct of such. You talked about in vitro fertilization earlier. The impact on any infertility expert in the world that does test tube babies is affected when in Holland twins were born, one was black, one was white. In the laboratory, it so happens that a sperm from Aruba that belonged to a previous couple happened to still be in the pipelle and fertilized the egg of a Dutch lady before her husband's sperm. It's her egg, it's her baby, but it's not her husband. When in Irvine, physicians very well known in my field found it okay to take embryos of patients who were already pregnant and didn't expect them to come back and substitute them and insert them in other patients, telling them it was their embryos when it was not, just to make them happy so they're pregnant. Do you know how devastating it is for all of us? But this is much bigger, because you're talking about economic forces. The control of this genocide is not in the hands of a few physicians. It's in the hands of corporate management, CEOs, COOs, attorneys that work for them, insurance companies that cover for them. And the law was written by them. You see, I wouldn't be where I am today, advocate, if there was some miracle drug we could use, or maybe some magic electronic box. The black box, sorry. The black box I devised is not an electronic box. It's a way to create a pool, like a jury, of physicians, nurses, pharmacists. Errors can be not necessarily due to a physician. It could be due to an electronic device. It could be due to pharmaceutical error, a nurse mistake, fatigue, many possible reasons. The problem is, as Professor Lucian Leep from Harvard points out, is in any industry, if you buy a television, a car, you have a warranty. If your product is defective, you're going to have to return and you're going to have to replace it. If it's not a good product, you're going to be bankrupt. So in the healthcare industry, and by the way, in the legal profession, it's the same thing. You cannot provide any warranty. But here's where it becomes, as Professor Lucian Leep says, perverse. You benefit economically from errors and complications, because now you can bill for services you would never had to provide to begin with. And this is out of the hands of physicians. This is under the control of management of hospitals, and it is not only facilitated, it's encouraged by the law, because the law gives carte blanche, total immunity, to hospitals to do whatever they want. So when a physician like myself, believing he or she is doing his duty by simply agreeing to testify for what is most certainly an outrageous, egregious situation, I have been retaliated against, and my medical career has been put on hold. You're right, I had a choice. I could have abandoned medicine, go back to the hole I came from using the language of the attorneys of the hospitals. They wished me to disappear. They buried me according to their protocol 5,000 feet below the ground several times, and I have the bad habit to come up to a volcano.